The KULR 8 Medical Minute is brought to you in part by Billings Clinic.
Varicose and spider veins are not only unsightly, but they can also be painful. In tonight's Medical Minute, we look at a relatively pain-free way to get rid of them. 1 in 3 Americans age 45 and older suffer from vein problems in their legs.
If one parent has venous disease, there's a 70% chance that their children will have it. If both parents have it, it's 90%.
Dr. Bo Johnson with the Rocky Mountain Vein Clinic uses laser and radio frequency treatments to correct painful, bulging, and let's face it, not so pretty varicose and spider veins.
The symptoms are the heavy, achy, tired, restless feeling.
38-year-old Julie Donald is one of Dr. Johnson's most common patients, a teacher who has spent years on her feet.
Getting to be so that I didn't want to wear shorts anymore and because of the bulging, and then my feet were really swollen by the end of the day so that my shoes were hurting.
Okay, staying in the burn here.
Dr. Johnson says most vein issues stem from leakage in 2 large superficial veins in the legs.
Put a little numbing medicine in the skin and put a little catheter up inside the vein and put some numbing fluid around the vein.
Then he does not pull the veins out. Rather, he uses a laser or extreme heat produced from the radio frequency device to plug the veins so blood cannot flow through it anymore.
So right now it's heating up and injuring the vein and closing it.
He uses ultrasound to guide him through the process. Donald has already had the procedure done on her right leg and is now having it done on her left. She's also having a second procedure done called microphlebectomy, where the smaller varicose veins just underneath the skin are cut out. She says this is the most uncomfortable part. Take a look at some before and after shots of Dr. Johnson's patients. You can see the ropey varicose veins are gone. Dr. Johnson says plugging the veins doesn't compromise the blood flow to the legs because your main blood supply comes from the deep tissue veins. And he says there's a 90% success rate that the veins won't reopen.
It's not a burden at all to have it done because it's worth the results.
Okay, ladies, heads up here. Dr. Johnson says crossing your legs can contribute to creating those varicose and spider veins because it causes pressure, so keep an eye on that. And the procedure is covered by most insurance providers. Dr. Johnson also has a vein clinic in Cody.